Please join me in welcoming our wonderful panelists. And Dr. Kano, please come to the podium.
Well, thank you so much. It's so great to be here and with such an esteemed panel. And this is my first time actually coming here, so it's really, really beautiful here. So I'm excited. My name is Dr. Kyaien Connor. Just to tell you a couple, well, actually, I think you heard probably more than enough about me and all of us, which is great. But I think one of the things that is important to the lens that I take to this work, also as a social worker, is that I'm a clinician. I'm a mental health provider. I was a clinician before going back to get my doctorate. That was intentional. I actually had no interest in being a researcher. I came back to get my PhD because of inequities that I was seeing in the field and in the community with the clients that I was serving, and in particular my work in low-income communities and with marginalized communities. I was seeing not a whole lot of great work that was leading to impact, and so I decided, I guess maybe I could be a person that goes back and gets my doctorate, and I could answer those questions and do some of that work. So that informs all of the research that I engage in, which is largely clinical interventions research and research that looks to eliminate barriers to service utilization and treatment outcomes, to address health inequities. And one of the biggest barriers and hurdles we continue to see is issues around economic injustices. So I've been told I only have 10 minutes, and that's really not a whole lot of time because I have an entire course on this topic. But I figured what would be helpful is to kind of give a bit of a broader stroke to better understand the connection between these topics. And then if people have some additional questions about some of the research, we can get into that in the Q&A. I always talk about this first in terms of the importance of health as well as mental health, because I think that one of the paradigm shifts that I had to have as a researcher and clinician is that health is more than just the absence of illness. Mental health is more than just the absence of mental illness. A lot of the work that we end up doing, and even some of the treatments and policies that we develop, are often reactive. It's about treating something once a bad thing has already happened. How do we get people to access care? How do we make sure that people have doctors? How can we make sure that they have the money to get that treatment? When really part of our work could be shifting that perspective to how do we keep people well in the first place? How do we put research monies and dollars into prevention and enhancing the climate in the environments that we live in that help people achieve that optimal health and mental health, because we know the significant impact that it has on all of these different variables of our lives. We know also, however, that mental health challenges are incredibly common, and many of us would recognize that we are currently in a mental health challenge. I've been doing sort of a tour talking with colleges and universities where they are seeing some of the highest rates of mental health challenges that they have ever seen. 2 weeks ago, I had to leave a high school in Washington, D.C., where one of their young people had died by suicide, and it was ravaging the rest of the students, and they didn't quite know how to handle and deal with the emotions, and yet we're not talking about this in as intentional a way as I would like for us to. This is a real significant challenge where we're seeing 1 in 4 adults experiencing a mental health disorder every year, 1 in 20 severe and persistent mental illness. Death by suicide continues to be one of the leading causes of death and is rising in our young people. This is something that we need to be taking very seriously, and of course the consequences of the injustice and the pandemic of COVID-19, which has disproportionately impacted communities of color, continues to be something that we are dealing with even in this post-pandemic period. The numbers have not reset. People are still having significant struggles with mental health, more so than they may have ever had before. And then in addition to the pandemic of COVID-19, the pandemic of racial injustice, which has continued to address and impact the health and mental health of our communities for many of us in ways that we may have not ever fully understood. Race-based trauma is a real mental health challenge, and one does not have to experience that trauma directly for it to be traumatic and to have real mental health implications. And for many of us, we've never fully healed from that or given ourselves the space to cope and deal with the potential ramifications of how some of those mental health symptoms may be impacting us in our day-to-day life. In fact, when we think about sort of mental health and racial justice, we know that despite the fact that for most sort of diagnosable illnesses, we don't actually see a lot of variation by race and ethnicity, but according to the Office of Minority Health, Black adults in the US are 20% more likely than whites to report persistent symptoms of psychological and emotional distress. Again, while prevalence rates are similar, Black adults are more likely to report severe and persistent illness that is resistant to treatment. We are more likely to see high rates of misdiagnosis in this community, a lot of that due to a lack of cultural sensitivity in our diagnostic measures. There was a long time where we used to think that Black people were more likely to have schizophrenia. We know now that that is absolutely not true, but just a lack of understanding of differences in cultural presentation of symptoms. Again, we talked about death by suicide on the rise, and unfortunately, despite high need, this is a population that is significantly less likely to seek care, in fact, half the rate of their non-Hispanic white counterparts. Concurrently, we're also seeing very significant health disparities. And for Black and brown communities, you could talk about pretty much any illness that you want, and you're going to see significant disparity in that it is impacting Black and brown people in a more salient way. They are more likely to die from that issue. They're more likely to have enhanced morbidity or difficulty functioning or disability from that issue, less likely to have access to treatment for that issue across the board. And often mental health and physical health, of course, intersect. So although we're always trying to separate these two, they are intrinsically connected and have a significant impact on all of us. When we try to better understand why, what is leading to some of these inequities, what is leading to some of these disparities, of course, we're always pointing back to the social determinants of health. And looking at the various ways and mechanisms in which we are seeing people having less access to achieving optimal health, optimal mental health. One of the things I think is really important for us to recognize is that even though this first column focuses specifically on economic stability or instability, when we really think about it, this economic stability column impacts every single column that is in the social determinants of health. If one is not having economic stability, that's going to impact where they're able to have a home, the community that they're going to be able to live in, their access to variations in education and higher education, their ability to pay for and access healthy foods, the community, their exposure to discrimination and the support that is available in those communities, as well as their access to health and health care. So one of the first things that we have to start doing is recognizing that although we kind of want to piece some of these social determinants apart and focus on one at a time, they are all connected and they interact in complex ways that mean we have to address them all. There continues to be a very consistent link between socioeconomic inequalities and poorer health and mental health outcomes. We also know that income inequities can actually predict the occurrence of mental illness, health challenges, and actually how long someone is going to live, sometimes just based upon zip code and geography. We also know that this has become increasingly challenging as income inequities are continuing to grow, and the rates of difference between different groups continue to widen, which also is perpetuating and exacerbating these health disparities, which also, unfortunately, are continuing to get worse. And of course, we know that the US has among the highest and largest income-based health inequities in the world. Health inequities also impact access to care in a variety of ways. I was already given the 3-minute sign, so I know I don't have time to go into these in detail, but I guess we probably also can read this and understand that economic inequity impacts our ability to have consistent transportation, also impacts our ability to have insurance. And when we think about mental health, that becomes an additional challenge because even having insurance does not necessarily mean you're going to have access to quality mental health care. So there continues to be a lack of parity there. High cost of co-pays, geographic challenges where you live, being able to have ready access to care, other competing financial demands. If I'm having to make decisions about putting food on my table, I'm not really thinking about going to the doctor. That becomes a lot less important to me than making sure that my children have something to eat. Lack of consistent primary care, which is often where low-income individuals tend to have their first point of contact around mental health, not a psychiatrist, but their PCP. And low health and mental health literacy, not knowing where to go to get help or services, and having less access to culturally sensitive care. There's also these other kind of behavioral and environmental conditions that income inequities expose certain communities more to in a greater amount that also then have an impact on health and mental health. Smoking and other substance use, less access to nutrition, under-resourced schools, environmental pollutants, mass incarceration. So all of these things are incredibly connected, and as we know, racism continues to be a public health crisis, which is a social determinant of health, but also is placing many of our communities at increased risk for significant health and mental health disparities and needs to be addressed. And the other just real quick thing I want to mention is that while we do talk about how economic disparities contribute to health and mental health outcomes, the other is also true. Poor health and mental health contributes to economic disparities. If you aren't able to achieve your optimal health or mental health, you can't contribute productively to the workforce. You're going to have a difficult time being able to get a job and make an income. So this complex relationship, sometimes called the health poverty trap, continues to exacerbate these challenges for our communities. So I've been given 0, and right on my conclusion slide. So to sum up, we continue to see health inequities because we're failing on equity. And we could talk more about this later, but some of my challenge as a public health researcher has been we're always trying to, in terms of address health disparities, get people access to care, make sure people have a primary care physician, help people have insurance. But if we continue to have inequities in all of our other social determinants of health, we're going to continue to have health disparities because they're all connected. Inequity in these other areas is health disparity, and achieving economic justice is achieving health equity. So we have to do that work together and in collaboration. Thank you all so much.